if I can begin with some questions on essentially what is the lack of detail, or what's felt to be the lack of detail, which has been left for secondary legislation, and I suppose the lack of local accountability that many of you have shared in terms of your submission. I wonder if I can start with the Cosla approach and the Cosla submission. I think it's fair to say that the Cosla submission is very concerning to read in terms of the view of local government to what this bill will do to the provision of services in local government. Indeed, I know that there has been unanimous cross-party concern at Cosla raised about the bill. And that leaders indeed have unanimously agreed that position. I obviously was a councillor for 10 years, and I don't recall such unanimity at Cosla, particularly through leaders. So I wonder if Councillor Kelly could explain how that position was reached and what those concerns are.
Thank you, and good morning, everybody. I'm glad to be here on behalf of Cosla. As you've outlined, leaders unanimously and cross-party had very, very serious concerns on behalf of all local authorities across Scotland at the current format of the National Care Service. It's clear to us it's bureaucratic, it's centralisation and it's expensive. We're also extremely concerned by the lack of detail that's contained within the bill as it currently stands. We all around this table know the vital services we're talking about in social care and social work. We know how important they are to the people we represent, to the service users, and we know the crisis we're facing right now in winter. So the transfer of potentially 75,000 staff, which is 29% of the local government workforce, with the lack of detail around the finance and what that transfer will mean, is extremely concerning to local government. It's extremely concerning to our staff, and it is extremely concerning to service users. And I think there's a huge element of risk when there is such a lack of detail and a lack of opportunity for committees like yourself to properly scrutinise this, to properly look at the issues we're facing, and to properly come forward with a plan that we all want to see to improve social care, to improve social work, and to improve the services that people get across Scotland.